I'm Karis.
I'm Marissa.
And we had Is Weight Bias a Serious Issue in the Healthcare Industry? So to start why this is a current topic, weight bias is the negative attitudes and beliefs attributed to an individual based on their body weight. And weight bias stems from perceptions that obesity is caused by failures of the individual to control their food intake. And the characteristics that define this is assumptions that people living with overweight or obesity are lazy, incompetent, lacking willpower and self-discipline, and not motivated to improve their health. The problems in healthcare, a lot of it has to deal with quality of care, and evidence shows that doctors are aware of the health risks associated with obesity. However, they're not consistently trained on the best practices for obesity treatment. Identifying a lack of time for and are not reimbursed for weight loss counseling. The quality of care and clinical judgment of physician-based weight bias has been shown to result in less time spent with obese patients, reduced engagement in discussions with patients, and the provision of less interventions, and the avoidance of carrying out preventative health screenings on patients with obesity compared to patients without obesity. The experience of the patient. Specific concerns identified by patients were that physicians and other healthcare providers had not recommended weight loss interventions and perceived that their healthcare provider as not having a good understanding of the causes and consequences of obesity. The pervasive nature of weight bias also increases the long-term risks of many health issues, especially with heart issues. And this is shown more prevalent in people with obesity.
Hey guys, it's Karis again. So this diagram is just to show that weight bias isn't only in the healthcare system, although it is very prevalent. It's also in schools and videos, even like elementary schools, which is very sad. And to help you understand this a little better, we have a quick video. Okay, so just a little side note. This is not a problem because heavier Americans are necessarily unhealthy, BMI does not offer a perfect assessment of health, and being overweight does not guarantee illness. However, excess body weight can play a role in the development of many health concerns like coronary artery disease, stroke, cancer, and type 2 diabetes, which is a very important health effects. Some impacts. Weight bias not only poses adverse mental and physical health consequences such as exercise avoidance, anxiety, low self-esteem, and depression, but it also negatively affects healthcare treatment outcomes, which is very bad. So is this a controversial topic? So this whole thing starts with nervousness. The individual is nervous to go in and seek help in the first place, and they might be embarrassed. They might not want to be measured, weighed, and it's a valid reason. It can be very mentally tolling. And some argue it's untrue or not a problem, which is part of the controversy. Or they might think, oh, I don't have a bias, or if they do have biases, it doesn't affect the patient, which it obviously does. And it just makes the problem worse. It's just a vicious cycle, which is very unfortunate. And I did some research on a J et al. Study, and this was it was a survey of 338 nurse practitioners, and they were asked about their beliefs and attitudes about people with obesity. The results were very sad. Many reported having negative attitudes towards them, claiming they were unfit for marriage, messy, not as successful as others, or unhealthy in several ways. They also asked 250 physicians, and 40% were reported to have similar negative attitudes towards them. And majority of these physicians said they were frustrated in treating patients with obesity, and if there are actually people out there who are supposed to be treating those who are seeking help, there's a real issue. They're seeking help. They shouldn't be receiving disrespect. So here is a little graphic representation of the opinions of patients and healthcare professionals about weight bias in healthcare. Some of the bigger ones are 69% of patients report that physicians are a source of weight bias, and 31% of nurses would prefer not to treat patients with obesity. And physicians are the second highest source of weight bias, which is very disappointing graphic representation. So as I said a little bit before, it's a vicious cycle. It only makes the process worse and worse. It starts with obesity on the top in the red box, and then it leads to health consequences, and then that leads to increased medical visits, and boom, bias in healthcare. And that creates more negative feelings, and then thus the avoidance of healthcare and more unhealthy behaviors, and then back to obesity. It's just a cycle. It gets worse and worse. So what side are we on? So first off, there isn't much controversy on the topic other than the stats and whether one believes it's true or not. Some doctors may argue that pressuring patients about their weight is simply their way of trying to motivate them to be healthier, but that logic doesn't make a lot of sense. And from the stats in the study said before, a majority of healthcare workers reported that they felt uncomfortable even touching patients with obesity and had biases about them. And no matter how hard you try to hide those feelings you have about someone, it always comes through. You can always tell. It's an uncomfortable situation. And from an ethical standpoint, I think that this should not be an issue. Just like anyone, you don't know what they've gone or are going through, and they could even have mental disorders or struggles that in their life that so heavily impacts their attitudes and lifestyles that they have become physically unhealthy. And who are we to judge what a person is going through? So personally, I think healthcare workers shouldn't be in healthcare if they can't learn to treat all human beings with respect and decency. And humans will be humans, and there's always going to be that disrespect in the world. But although the individuals don't have the healthiest lifestyles, that's no reason to disrespect them for their health choices, but rather to help them. And I think that weight bias is a serious issue, and it really needs to be addressed. I think doctors should go through anti-discriminatory training for this cause, not just this, though. There are many other areas in which it affects people. And we need new anti-weight bias curriculums that strive to educate med students and physicians about the complex interactions between weight and overall health. And also the non-voluntary genetic and environmental factors that contribute to this development of obesity, and just overall ways in which physician biases can harm patients is really good to know. And I think there should be training through it.
We can conclude that all of our sources would agree that there are many contributing factors that relate to the issues within weight bias in healthcare. Factors such as weight bias within healthcare professionals, the proper resources, and quality of care for those who are obese. The high percentage of weight bias within healthcare professionals draws a concern for those struggling with obesity, as they rely heavily on professionals both mentally and physically, and most likely do not get the proper resources and patient care. So this quote on this slide kind of concludes how we could make a change within the problems of weight bias in healthcare. And it states, we can implement training and education about weight bias for healthcare professionals to help them provide more supportive, compassionate care to individuals with obesity. This graph shows the varying presence of weight bias in different professional health fields. As you can see, explicit professionals have a higher percentage of weight bias. If your friend or family member were to ask you about this issue, how would you explain it to them in a way that they could understand? There is a strong presence of bias in the healthcare field revolving around weight. The lack of training for how to treat obesity, along with the lack of empathy for patients, is a severe issue.
Thank you.
Thank you.